individual session 2. Nice to see you again.
Hi, nice to see you again.
As before, emergency exits are that way and this way.
Yep.
And if you feel like you need to go to the bathroom, it's just down the hall.
Yep. Awesome.
If you do need a break too, just let me know and we can have a break if you
Awesome.
feel like you need one.
Perfect.
So today's lesson is indicators of abuse.
Okay.
Can you remember what we spoke about last session at all?
Last session was communication
Mm-hmm.
and how to effectively communicate with children. We talked about open-ended questions and closed-ended questions.
That's right.
The advantages of closed-ended questions, the disadvantages of them, the advantages of open-ended questions, and the disadvantages of closed-ended questions.
That's right.
And we talked about how eventually it obviously is going to link in with this session
That's
here.
right. That's what we're going to do today.
Indicated.
I just wanted to ask you quickly too, are you comfortable talking about this kind of content?
Yes.
Yeah, we're going to be talking about the 5 types of abuse.
Yep.
Where we can see that in childcare, what to do if you do see it. So we also have some scenarios. So we are going to be looking at things that could and probably have happened in
Okay.
childcare before. So you're comfortable with everything like that?
Yes. Yes.
Okay. So to start with, what is abuse in your eyes? Like, how would you describe abuse?
Either physical, emotional, social kind of.
So just like the general.
Just the general,
Okay.
general sort of abuse, I guess.
So you've
in a
never
sense.
learned about this topic before. You've got no experience with it.
No,
Okay.
no experience with it as of yet.
So what is abuse? Abuse comes in many different forms. There's 5 main forms.
Yep.
The first would be physical.
Yep.
Which can be seen in the form of bruises,
Yep.
cuts or open wounds, reoccurring health issues due to physical abuse, like if a child constantly has a broken arm,
Okay.
or if the child constantly has like bruises in the same place,
Yep.
broken bones, concussions, burn marks, and FGM.
What's FGM?
FGM stands for female genital mutilation,
Okay.
which in some cultures they'll cut off a female's clitoris so that they can't experience pleasure during intercourse.
Okay.
So in their views, females shouldn't have pleasure
Yep.
during intercourse. Their main job is to bear a child and to give birth to a child.
Okay.
And they also think that will prevent them from having sex before marriage.
Yep.
So if we see any form of FGM while changing a nappy or helping a child go to the toilet, or if they disclose that to us, that is also a form of physical abuse.
Okay.
And we have to report that straight away.
Yep.
What you'll see is part of the vagina will be missing.
Yep.
There'll be stitches or scarring. So if you see anything like that, you report that straight away, and it will be taken very seriously because it's obviously illegal to do that to a child.
Yes.
So that's FGM.
Yep.
Do you have any questions about physical abuse so far?
No.
No?
Nothing yet.
So that's one type.
Yep.
Second type is neglect.
Yep.
So that would be an unwashed child, unwashed clothes. So if you see them repeatedly coming to childcare in the same clothes.
Yep. Of course.
Obviously if they do come to childcare in the same clothes, that doesn't automatically mean neglect. Like the family could wash the clothes, dry them, and put them back on the next day. So if you see a child wear the same clothes 3 days, or 4 days, 5 days, it's not automatically neglect.
Yeah.
It's more so if they have a smell,
Okay.
like if they smell really bad,
Yep.
if they're really, really dirty, that's a form of neglect. But obviously wearing the same clothes twice in a row isn't neglect.
Is it more
It's
if the clothes, if they come back in the same clothes, but like as you said, the clothes are dirty?
Yeah, and it's obvious that they haven't been showered or washed.
Yes.
Like it's literally they've come back how we left them the day before.
Yep.
That's neglect.
Okay.
The child is constantly starving. There's a difference between being hungry and actually starving.
Yep.
So if a child has 3 portions, they're not neglected. That's normal. If a child is having 5 to 6 portions at lunch, and the way they're eating is scoffing it down like they haven't been fed, that can be taken as a form of neglect because
Okay.
they are obviously extremely hungry. They haven't been fed at home. If the child looks to be malnourished, like if they say they get wet and you take their clothes off to give them a fresh pair of clothes, and you can see like their rib cage is sunken in, their cheeks are sunken in, like they look
Yep, they look
starving, they
malnourished.
look
Yep.
really hungry, malnourished. Some children are skinnier than others, so if you see a child with their ribcage showing, that's not automatically neglect. Like they might be growing at a faster rate or have a really fast metabolism.
Yep.
They're picky eaters, so they don't like to eat. Like the families are trying to get them to eat,
Yep.
but they aren't eating.
Okay.
So obviously you would discuss that with the family.
Yep.
Like they would disclose that to you, and you would know of that.
Okay.
But if the
Cool.
child is eating heaps at school and you can still see their bones, they have really yucky clothes, they smell bad, that would be
Obviously forms
neglect.
of neglect.
Yes.
Multiple forms of neglect.
if they lash out,
Mhm.
that's them. That could be them showing behaviours that they see at home.
Yep.
Like if they lash out over small things, that can be a form of neglect.
Yep.
And doesn't receive medical care. So if they hurt themselves really badly and the family doesn't get them seen, like take them to a doctor, or if they're really, really, really sick, like temperatures, vomiting, gastro infection, conjunctivitis, if they're not getting medical treatment,
That is
that's
forms.
also a
Okay.
form of neglect. Any questions yet?
When it comes to the not receiving medical care,
Yep.
how long do we let that
That usually
before
depends
we
on the centre.
report?
You
Okay.
never ask the parent about it. You
Yep.
always go straight to directors, because if
Okay.
you were to ask a parent about form of neglect or any of these forms of abuse,
Yep.
they can obviously deny it. They
Right.
can keep their child home from school, and you may never see that child again. It could
Right.
also make the abuse worse.
Of course.
So we never disclose any abuse to parents.
Yep.
We never ask any questions about it. We always go straight to our room our room coordinator,
Yep.
the boss of the room, and then together you guys go to the director,
Of
and
course.
then we take it from there, which I'll tell you.
Yeah, no, of course.
But yeah, we never ask the parent. We
Yep.
always go straight to the top first, and then we discuss it with them and go from there.
Yeah, okay. Awesome.
Emotional abuse.
Yep.
So this can be seen in like rocking or head banging stimulation, like trying to calm themselves,
Yep.
almost going into like, not, well, I guess almost survival mode, like just trying to calm themselves down over small situations that happen at school.
Yeah.
Crying excessively over small things, or that may seem small to us, or not crying at all, like
Okay.
withdrawing emotionally, could be how they cope at home,
Yeah.
and seeing that behaviour at school would be a sign of abuse.
Of something happening.
Yeah.
Yep.
Displaying significant delays in both fine and gross motor ability. So fine motor is like small things like threading or building. Gross motor is like running, jumping, kicking a ball. That's gross motor. So big, and fine motor is small.
Yep.
Which you've obviously learnt before.
Yes.
Delays in fine motor could be they're 5 and they still can't hold a pencil.
Yep.
It could be they're 3 and still not walking.
Yep.
Like that's a sign of, like that could be a result of emotional abuse. They don't feel comfortable. They haven't been supported in learning those skills at home.
Mhm.
Or a parent / carer of the child is unresponsive or impatient to their child's emotional cues and doesn't want support of any kind. So it could be the parent picks up the child from care, they're
Yep.
crying, doesn't,
Doesn't bother.
they're not phased
Right,
by it. Or
okay.
the child runs over to them, really happy, excited to see them, the parent doesn't respond in the same way. It's more just impatient, let's go. Like,
Yeah.
they don't reciprocate the emotions that the child displays of being happy.
Okay.
Not to say that that's abuse, but that could be a sign
That
of
could be a
abuse.
sign of it. Okay.
Of
Yep.
further,
Of course.
so just keep an eye out. Like,
Yep.
like the parent could have had a bad day,
Yep.
busy day, but if it's consistent, then
If you see it more than
that's right.
3 or 4 times, it could be a sign.
That's right.
Okay. Awesome.
So that's emotional. Do you have any questions about emotional abuse?
No.
No?
No questions.
Next it would be sexual.
Yep.
So injury to the vaginal or rectal area, so bruising, bleeding, discharge, inflammation or infection. So while you're changing their nappies
of
or
course.
helping them to go to the toilet, if you notice anything like that, like bruising, shouldn't really be around that area,
Yep.
or inflammation, all of those things could lead to sexual
Abuse. Yeah.
excessive injury to areas of the body such as breast, buttocks or upper thigh. Excessive, not just one bruise, like almost handprints or multiple
Yep.
bruises around the area. So that could be a sign of abuse.
Yep.
Discomfort, urinating, or defecating
Mhm.
could be a sign of sexual abuse. Like lots of, say, UTIs, urine tractory infections.
Yep.
That could be a sign too.
Okay.
It might not be, like some children just get them a lot.
Yep.
But if there are other signs and that's one of them, that could be,
It could be
a sign of abuse.
Of course.
Sexually transmitted infections obviously shouldn't be happening in children.
No.
So if you notice that, that is a really big sign of sexual abuse. And as I said before, frequent urinary
Tract infections. Yep.
Any questions about sexual abuse?
Just with the bruising,
Mhm.
for example, if the child does a bruising on the breast area, what happens in that scenario? Would I just report that to my room coordinator?
Yeah, always report to room coordinator
Yeah.
first, and then from there we'll go to directors,
Okay.
and then from there we'll make an MRG.
What happens if it was just a once off?
That, yeah, if it's once off and it's not excessive, like if a child has a bruise, say, on their chest, that
Yeah.
you wouldn't go straight to being abused.
But if there
But
was multiple
If
bruises,
there's lots of bruising
yeah,
around just that area, that could be a sign. So you tell your room co, the
Yeah.
room co would then have a look, and then
obviously, and even if it is just a once off, still
yes,
tell them.
would
and
still
then,
tell them.
okay,
Yeah,
awesome.
even if it's you just tell them, and then just so you know
Yeah.
yourself that
You've done the right thing.
yeah,
Yeah.
exactly.
Okay.
And the
Awesome.
last sign is domestic violence.
Yep.
So domestic violence includes many different forms of abuse, not just one category specifically. In a household where domestic violence occurs, the abuse could be physical, emotional, sexual, or neglect.
So it could be all.
So
four.
domestic violence
Yeah.
could be one or all four. It comes
Okay.
in many different forms.
Yeah.
So main indicators of domestic violence taking place could be speech disorders or delays. Like
Uh-huh.
if a child's say 3 and they're still not speaking, that could be from fear or anxiety. But it also could be just a speech delay, which
Yep.
they're seeking help from a speech pathologist for.
Yep. Of course.
It could be delays in physical development, obviously the fine and gross motor. If they're 4 and still aren't kicking a ball, if they're like 3.5 and still aren't walking,
Yeah.
if they're 5 and can't hold a pencil, there's a difference because we work on, it's called pencil grip, so
Mhm.
how to hold a pencil. If a child's 5 and can't do that, it's not a form of domestic violence, it's just they need support. But if they literally don't know how to pick up a pencil, or they don't know how to colour in, that kind of thing, that could be a sign of neglect, which comes under domestic violence.
Of course. Of course.
Failure to thrive in their environment, like they're not comfortable and they've been there for a long period of time, that could be a sign. It's not a huge sign, but if there's other indicators and that is one, that
Yep.
could be counted as a sign.
Yep.
Acting out, such as cruelty to animals, or their peers.
Okay.
Like if a child is 4 or 5 and they're still excessively biting other children, that could be a sign of domestic violence.
Yep.
Because at that age, you should be able to communicate without biting. Whereas in the younger room, like the toddlers or babies, biting is age appropriate because they can't communicate their frustration or anger or their needs
Yep.
verbally, so they lash out with like hurting, pushing, biting. But when you get to the older age groups, if they're still biting, that is a sign.
Something could potentially
Something could be happening.
Okay.
So they've seen that behaviour at home. That's
Yeah.
how their parents like resolve conflict, is hurting one another. That
Mhm.
could be a sign of domestic violence.
Okay.
And overly compliant, shy, withdrawn, or passive. So they're trying to make the educator happy. Like
Yep.
if they're sad, they don't display their sadness because they don't want to upset the educator. Because at home, if they display their sadness or unhappiness, it could be punished,
Yes.
or they might be yelled at. They might be like, "Oh, you're sad. Like I'll give you something to be sad about," kind of thing.
Yeah. Of
Like
course.
their emotions could be used against them. So at school,
They're going to pull back,
they will,
obviously, and yeah.
revert into themselves. So
Yeah.
that's a sign of domestic violence. So the 5 signs are physical abuse, emotional abuse, sexual abuse, domestic abuse, and neglect.
Okay.
Those are the 5
And
forms of abuse.
domestic abuse is
Like a mixture
or
of
could
all
be a
four.
mixture of all
Yeah.
4. Okay.
Yeah.
Yep.
What do we do if we see it?
Obviously, straight away report it.
Yeah.
Obviously to my room coordinator, and then as you said, together we both obviously go to the director. and make a plan from there on
Yeah.
how we should act.
Some centres, that is like, I guess not a draft, but like a generic.
Yep.
You go to your room code, you go to the director, you go from there. Some centres might do it a little bit differently.
Mm-hmm.
Like the order might be different, but that is what most centres do.
Okay.
They go from, if you see it, you tell your room code. If it is the room code that's seen it, they go to the director, and then from there, with the director, you usually do a mandatory reporter guide,
Yep.
which is what we're going to do a bit
Right.
later on.
Awesome.
So this is usually what the steps are.
Yep.
There's a protocol/process within the childcare industry when it comes to mandatory reporting. So we are mandatory reporters, which
Yes.
means if we see a child being abused, the 5 abuse stages that we just went through, if
Yep.
any of those pop up in childcare, we have to report it. Same as bus drivers, if they're driving children, if they see any form of neglect, emotional abuse, physical abuse, domestic violence, they have to report
Have to
it too.
report it. Yep.
There's lots of industries. Basically, if you are with children at any point within your role
You
and you
have to.
see
You're
something, you're a
mandatory
Mandy reporter.
Yep.
So first is let the room leader within the child's room know of your concerns
Of course.
first. Next is document the suspected abuse in a blank book.
Okay. Yep.
So this will include the child's name, date of suspected abuse, what can be seen, what the child has disclosed, word for word, if they were
If
to
they
tell you.
choose,
If
yeah.
they're 2, they can't really tell you. If they're 4, you could use open-ended questions, like we learnt before,
Yep.
to communicate with them about what
And,
may or
and
may
it
not.
has to be word for word.
It has to be word for word.
Yep.
So you'd put, I asked what happened. And then in brackets you would say exactly word for word what the child said. So when you're talking to them though, you're not going to have a notebook and pen out.
Obviously.
If you're on your own, you try your best to remember.
Mhm.
But if, say you're in a group time, a learning session, and a child starts to disclose information, one of you will go and discreetly get a book
Mm-hmm.
to write it down, and then the other will then
Continue asking questions.
continue the
Okay.
conversation with open-ended questions.
Yep.
And then if the child is able to communicate, ensure the questions you're asking are open-ended. Obviously,
Yes.
you're not going to say, "Did Daddy do this?"
Yeah. Obviously.
and then yes or no. It's
Yep.
going to be, "Did someone like do this to you? What happened?"
Of course.
Kind of thing. You wouldn't say, you wouldn't ask, like, "Did so and so do it?" You would ask, "Who did it?
Yeah.
Like, what happened?"
The open-ended questions
Yes.
that we talked about last
You
time.
like to start off with. You might say, "Did a person do this to you?"
Yep.
Because then they could say, disclose if it was a person, or they could say, "Oh no, I fell over,"
Yeah.
kind of
okay.
thing. But if they say, "Yes, a person did do this to me,"
Then
you
you-
could then follow on with who.
Yep.
And then they will tell you who, and then you could ask why, how, when,
Yep.
or open-ended questions.
Yeah. Perfect.
And then you then take the book with the information that you have with your room code to your director.
Yep.
And then from the information you've collected within the book, you will fill out an MRG,
Okay.
which is a mandatory
Reporting.
guide.
Yep.
Using the information documented within the child's book, answer all the questions asked in the MRG. These are the 4 responses that you'll get from the MRG. Response 1 would be report the child to the Child Protection Helpline, call the number immediately or with the next 24 hours.
Yep.
Refer to a child wellbeing unit, consult with the CWU, which is Child Wellbeing Unit,
Yep.
or the other professional. Document and monitor.
Yep.
So say, like you said, the child has bruising around their breast area, might be one bruise.
Mm-hmm.
So document and keep monitoring that in the book that you made with your room code.
Yep.
So say 1 week they have it, it's gone, but then the next week it's back. So you
Okay.
document that and then go back to the MRG. You keep
Okay.
going back and then until
And each time we'll update you with a new.
exactly
step.
because at the end it will ask, is this like consistent? Does this keep happening? And if
Yep.
your answer is no, it will most likely say document and monitor.
Okay.
So if it happens more than twice, 3 times, then it'll go revert back to one of these.
Yep.
Report it. Call the helpline.
Okay.
And the last answer would be identify alternative support. So help identify support services for the child or young person.
Okay.
And then the educator will then action what the MRG has stated.
Okay.
Do you
Awesome.
have any other questions? Or are you ready to make the report?
I'm ready to make the
You have
report.
no other questions? You're completely fine to make the report? It's up to you. Do you have any questions or no?
Will you be here helping me go through?
Yeah, I'm going to go through with it on the iPad. With
Okay,
you.
awesome. That's perfect.
So on my last slide here, it says making a report. Using the scenarios, which I have here,
Yep.
we're going to fill out a report. These scenarios, I'm not going to say aren't real, because these scenarios could have happened,
Yes.
but these scenarios are just scenarios for this.
Am I able to just quickly read through the scenarios?
Yes. So 1, 2, and 3, we're going to be putting these 3 scenarios through the MRG and seeing what comes up.
Okay. Yep.
You comfortable with that?
Yep. Went through all of them.
We might just do it on here together instead.
Yep.
Because that's a bit easier than you doing it on there and then me doing it on here too. So I'll get you to
Do
do
it
it on the
together?
laptop.
Yep.
The screen's a bit bigger.
Yep. Perfect.
So first, I'm going to get you to type in mandatory reporter guide. So this is what you would do if you were to see or witness any form of abuse in childcare. Obviously, after you document in the book, consult with your room co and go to the director. So, mandatory reporter guide, you click on the first link,
Yep.
and this is the mandatory reporter guide. So with scenario one,
It goes through.
yeah. So scenario one, well, you've already read through it.
Yeah. Yep.
So Lucy is 6 months old and attends an education and care service Monday, Wednesday and Friday. Lucy's mother is Aboriginal and a night packer at the local shop, so Dad drops Lucy off and Mum picks her up. They live in a community where police often visit due to frequency of violence. It is Monday and Lucy's father drops her off. Lucy has just started to sit up whilst aided with soft pillows around her. You attempt to sit Lucy down, but she screams and puts her hands up for you. Lucy's father tells you she has been like this all morning and he has had enough and needs to get to work, and he leaves. You decide to check Lucy's nappy when you notice the nappy is soaked through. She has a nappy rash that has resulted in her bottom bleeding and a large red handprint at the top of her leg. Lucy is screaming and you attempt to place a clean nappy on her. You gently place nappy cream on her bottom as permission has been granted in the enrollment form, and pick Lucy up to console her. So what form of abuse do you think that would come under?
Physical abuse. Physical and neglect.
So it could be both.
Could
So
be
let's
both.
read what they say. You suspect a non-accidental injury or physical harm to a child / young person may have been caused by a parent, carer or other adult house member.
Yep.
You know of a treatment poverty between parent, carer, or household member that may have caused or is likely to cause injury or physical harm. That's physical.
You suspect that a parent slash carer is not adequately meeting a child slash young person's needs, such as supervision, shelter, medical care, hygiene, clothing, mental health care, schooling slash education, nutrition, or other basic needs. A child slash young person is in danger to self or others, and parents slash carers are not supervising or providing
So I would
care.
say neglect, because in terms of this says soaked through, that means it's gone through the nappy into the child's
Right
clothes. So the
through,
child has wet
Herself.
clothing
Mm-hmm.
and hygiene. So I'll press neglect. So neglect concerns. Please choose the neglect concern you have for the child slash young person. So what would you pick?
Hygiene slash clothing.
That's right. You've got to pick the dot. There you go. And scroll down to next. The next question.
Neglect medical. Are you a medical professional?
So no,
No.
we're not medical professionals.
Is there a pattern of the child slash young person being extremely dirty slash unhygienic, especially inappropriately clothed? I'd say no.
I'd say no, because by this scenario, we don't know if it's happened before.
Yeah.
So say no.
Has there been a significant incident
I'll say yes.
due
there
to the
has.
nappy rash?
That's right. The bleeding and the clothes being urinated.
Yep. Is the child slash young person dirty or inappropriately clothed that he slash she will need medical care? Would you say no because
I would
of
say no.
nappy rash?
Nappy rash cream isn't medical care. I would say no for this scenario.
Okay. Is the child slash young person similarly affected emotionally and or behaviourally?
I would say yes, because she was really
Screaming
upset.
and crying for us to.
That's
cry.
right.
Yep. Is the child under 5 years of age or with disability? Yes, because she's under 5.
That's right. I would say yes.
Do you have other concerns about the safety, welfare, or well-being of the child in prison,
Because of where they live.
as well as the handprint on
That's
the leg?
right. So in this box,
Mm-hmm.
we're going to write everything we know. So we know you're going to write basically this scenario almost. So Lucy is 6 months old and attends an education and care service. Just write this scenario into that box,
The whole thing.
the whole thing. And instead of saying you, say I. Because in this scenario, this is you.
I don't know if I'll have enough characters to write the whole
How many characters does it say?
2,000.
I'm sure that's enough. This was probably about maybe 300.
Okay.
Well, only writing this first box.
This first one here.
Yes, just that.
Yep.
And if not, let me know and we can summarize it together. You okay?
Yeah, just.
Do you want to read it out to you?
No, it's okay.
Are you sure?
Yep.
It is a bit small. Okay, what are you up to?
It's okay.
No? What are you up to?
Lucy's father drops her off. Lucy's father drops her off. Yeah, Lucy's just saying.
Still okay?
Mm-hmm. Perfect.
Cool. So press next.
Do you have current concerns about the safety, welfare, or well-being of a class of children or young people?
No.
No.
I wouldn't say so. Would you?
No. No, I would not.
So what does it say?
I think the child or young person is in immediate danger. Phone 000 immediately. It is a legal requirement for a mandatory reporter to report their suspicions to the Department of Communities and Justice. However, Section 29A of the Children and Young Persons recognises that making a report does not necessarily exhaust mental reporter's duty of care for a child, young person, or their family.
So that was our result.
Our result is to.
If we think they're in immediate danger,
Mhm.
because of I think their living situation, call
Yep.
000, but the nappy doesn't require any further action. If this were to happen again, we would then report again.
Okay.
So that's it for that one.
Yep. So I'll just get out of here and come back in again.
That's right. So now we're going to go on to
The second
the
scenario.
second one, and then we just have this one and one more, and
And that's it.
so type in. Do you remember what to type in?
It was mandatory
Reporter guide.
reporter guide.
This should be that one.
Yeah, I did read through this. I can read through if you'd
Mhm.
like. 6-year-old Lindy comes to the child care centre where you are a provider and announces to you one day that she's old enough now to stay home alone. By way of proof, she says that she was at home alone the previous night because her mum went clubbing with her boyfriend. She was pretty scared, but her mum told her to just watch some TV and then just go to bed. That she's a big girl now, not a baby. Her mum wasn't home when she fell asleep, but was home when she woke up that morning.
So what do you think that would be?
I feel like again this would be another case of neglect.
That's right. Good job.
Supervision,
Yeah.
it'd be classed under.
Mhm.
Have you been informed that the child/young person is currently alone or will be alone? Yes, because she confirmed that she was alone last
Have you
night.
been informed that the child/young person is currently alone or
Oh,
will be alone?
No,
So
she's not currently alone. Is the parent/carer present but so inattentive that she is disregarding the basic immediate needs of the child?
I'd say no.
No?
No, because she is the parent/carer present but so inattentive. She wasn't present at all.
She wasn't
so no.
present. Okay. Are you aware of incidents in which the child/young person was significantly injured or narrowly escaped significant injury because the parent/carer was absent or not paying attention? No.
No.
Does the child/young person appear to be significantly affected by chronic parent/carer absent or inattentiveness? I'd say no.
Because she's only disclosed one time.
One time. Are you aware that the family is currently benefiting from services to address the problem?
No.
Do you have access to child wellbeing unit? Yes.
Yes.
Do you have other concerns about the safety, welfare, or well-being of the child or young person?
Yes.
Yes.
Type in this scenario.
Mm-hmm.
Okay. Done?
Yes. Next. Do you have current concerns about the safety, welfare, or well-being of a class of children and young people? No. If you think the child or young person is in immediate danger, call 000. However, our guideline on the MRG is to refer child to wellbeing unit. So obviously we would then get in contact with them and let them know.
That's right.
And if it continues to happen, put more further reports in, and then go from there.
That's exactly right.
Yep. Awesome.
Maybe just press start MIG. Doesn't make any
Perfect.
difference. So the third scenario, can you read that out?
Alicia, age 6 months, has a severe cough for at least 2 weeks. It has gotten so bad that her whole body seems to seize up when she coughs. She wheezes and seems exhausted. You are very concerned about her health and have expressed your concerns to her mum. Mum just keeps saying, it's getting better, the doctor will just tell me it's a cold and there's nothing they can do. It's a waste of time.
So which one do you think that might be?
Will this one again be a form of neglect?
It would be, yes.
This
What,
would
which-
be medical care for medical. Would it be a form of the medical care?
Medical care for medical professionals? No. Medical care for non-medical professionals? I would say yes. The second one. There you go.
Does child/young person have a physical health condition, includes dentistry, optometry,
So
optometry, yep, or disability that appears to need immediate care, but care is not being provided? Yes, her cough.
But look, a child just young
Oh
person.
no,
So
it's
no.
disability. Sorry.
That's right. Yeah.
Does the child/young person have a medical condition or disability that requires an ongoing treatment plan that is not being followed?
No.
No. Do you have other concerns about the safety, welfare, or well-being of the child or young person?
Yes.
Yes.
So
And
again,
then
type
just
that scenario.
one word. Okay.
Yeah. You okay?
Yep. Do you have current concerns about the safety, welfare, or well-being of a class of children? No. Document and continue relationships that's monitor.
So if consistently this keeps happening, like if say it's only been a week, but then
She comes in next week again.
that's right, you would just continue to monitor and repeat this again.
Repeat it again, make another form,
Mhm.
and then go from there.
That's right.
Okay, awesome.
So that's the end of this unit. Do you have any
Yep.
questions regarding mandatory reporting or yourself?
So mainly just the big takeaway would be, if anything does come up and I do see it and I do think it's a sign or form of abuse, report it to my room coordinator,
Yeah,
and then her and I together can go to the director,
that's right.
and then from there we can make the steps of whether or not we are creating any MRG or if we're going to just keep monitoring it and go from there.
And don't forget the piece of paper too. So
Yes,
you've
the
got
book,
a physical
a physical
copy of what's happened,
Yep.
and you can refer back to that if you do need to make further reports.
Awesome,
So that's it.
perfect.
Cool.
Thank
Well,
you.
Enjoy the rest of your afternoon
Thank you.
and of session 2.